Hi, everyone. My name is Elise Kleckner, and I am in the second group, and I will be doing a case presentation on edema. Okay. Okay, case presentation of edema by Elise Kleckner. Who is our patient? She is a 36-year-old pregnant African American female. She is currently 25 weeks pregnant, and to date, she has had no previous pregnancies. What symptoms does she have? She has been experiencing nausea and vomiting. States that she has had weird swelling in her face, hands, and feet. Severe headaches that frequently take a long period of time to dissipate. Frequent disorientation due to vision changes. Excessive weight gain that she says came out of nowhere despite eating healthy. And finally, feeling like she is short of breath even when sitting. Does she have any relevant history? Yes, she does. She was diagnosed with chronic high blood pressure at the age of 20. She is a type 2 diabetic that is not being controlled very well because she is overweight, and she has been overweight since a very young age. Also, it is important to note that due to the patient lacking insurance, due to being single with a low paying job, she has not been able to have her regular visits as she should. What physical exam findings were present on this exam? She was shown to have 2+ swelling in her hands and in her face that has been making it hard for her to see sometimes. Upon conducting a urinalysis, there was protein noted to be present. She had a blood pressure of 150/102, as well as a 20-pound weight gain since her last appointment a month and a half ago. What is my diagnosis? Well, based on all of the symptoms, both objective and subjective, and the presence of edema in her hands and feet, my diagnosis would be preeclampsia. Pregnancy can often bring upon many different conditions, and edema is one of the most common, but it's not usually in the feet. It is usually in the feet, but not in the hands or face where she is experiencing it. She's also predisposed to many risk factors that she currently has, like her age, the fact that this is her first pregnancy, chronic high blood pressure, diabetes of either type, the patient's race. Side note, African American females are at a higher risk of developing preeclampsia than any other race. Mayo Clinic 2024. What diagnostic tests would I conduct? Well, I would need to have an edema test done. This means that a medical professional would put 1 or 2 fingers firmly down on the patient's skin where the swelling is pregnant and then lift the fingers to see if it has left an indentation. This is a hallmark sign of preeclampsia and usually is the first to show up. Next, I would do a urinalysis to test for the protein in the urine. Also another sign. This is not a common finding and can be indicative of something more serious. An in-depth history of the patient and her health to find out what pre-existing conditions they may have had, as well as what family history there may be. I would also need to do a CBC and a CMP to look at how the cells are reacting to change. And finally, multiple blood pressure readings to be able to come to the preeclampsia diagnosis. How do we treat this? Preeclampsia can be treated with medications only if it is not considered severe. These medications are antihypertensives, which will treat high blood pressure, headaches, and reduce the edema, and anti-seizure medications. This is because having excessively high blood pressure consistently can lead to an increased risk of seizures. Then I would want to treat for any subjective symptoms that she may be having, such as the nausea and vomiting. Carrar et al. 2024. And finally, here are my references. Thank you, the end.